got a great opportunity in Greater Manchester to put a focus on elective care. We're forging a link with NHS England and the work that they are doing, and also creating a network in Greater Manchester dedicated to elective services. It has been the launch today where we've brought interested people together to think about actually what that will look like. Welcome. This is the first and the launch of the Elective Hub, elective care programme here in Greater Manchester. We've got several pieces of work in train, all of which we've discussed today, and we've had lots of really interesting feedback.
We need to come together as a system to do things differently. If we're not doing that, then we're doing the same as we've always done, and we need to see a change, and we'll only change the culture by changing what we do in terms of facilitation.
It's very important that we do share our knowledge in the work. Stockport's ECG has done a lot of work, and they're sharing their knowledge in the 100-day challenges allows us to take some of that learning and implement that.
It's like a welcome opportunity to connect with people that you wouldn't often, you feel like you've not got space to, so it's nice to come out of your day job and talk to the people who are experiencing the same challenges as you.
The day has consisted of a number of breakout sessions and discussion forums. They have been really energetic and vibrant. Really appreciate the feedback that we've had, the energy about doing things differently and working in new ways. That feels extremely positive.
Today I've actually been leading one of the workshops, so we've been talking about our experience of implementing straight-to-test endoscopy, which has been really interesting. So we've had an opportunity to talk through kind of what we've done around providing direct access diagnostics.
We're doing a presentation today for the teams of people on what they can learn from some global health systems around improving care for patients who are waiting on waiting lists.
So we've had a really good debate this afternoon about data quality and what we can do and what our ambition is in Greater Manchester to make that better.
I think that when you have the opportunity to discuss these type of problems at an event like this in a safe manner, actually there's some enthusiasm to do things better. The trick is, can we keep that enthusiasm going past today?
So the pathway work we've looked at are musculoskeletal services, dermatology services and gastro services, all of which we've got some great work programmes now in progress across Greater Manchester. We're pulling together that great practice, developing specifications. We're going to share those on our Greater Manchester website for people to use and enable a standardisation of services across Greater Manchester.
Most people here today have been patients at some point on an elective care pathway. For me, the most important thing is knowing that I'm going to be well cared for.
For me, it's the pathway and knowledge of where we are going and the expectations and managing my own expectations. That's the lead time of getting an appointment, what the process will be, and just having that knowledge so I can buy into the process and know how important it is.
As a patient, I would want an accurate diagnosis of my condition, and also as a patient I would want to know exactly where I was in the queue and when I would be treated by, so I could manage the affairs of the family and close relatives.
I think the most important thing for me would be to make sure that I was seen as early as possible by the right person and not kicked around the system waiting for a diagnosis.
I think, from personal experience in terms of when I've been doing it or relatives have, the fact that you go to the GP, you get told that a referral's been made and then you've no idea where that's up to, and a combination of then finding out that either the referral's not been processed properly or you've not heard anything back and you're just every day checking the mail. Really, just knowing where it's up to would be a real improvement in terms of a patient experience.
What I'm trying to do is to help systems see the opportunity of linking up the components of primary, community and secondary care to have a seamless pathway all the way from the patient's house all the way hopefully back into their house with no handoffs, just handovers, and actually the best possible diagnosis and care for them.
It was an opportunity for me to share what the group's been doing with other people and to help join up the dots. It's good to link in and help people to understand what we can do together and what support we can give each other.
We've got an opportunity to look at some of the really big problems for elective care and the big challenges at the moment, and I suppose I'd really like us to take advantage of that properly, because I think the partnership and devolution gives us probably a platform that we've never had before, and I think also an opportunity to really talk to people, and I think that's organisations and the public, about what the elective offer is.
We don't want just to be average, we want to be able to do something really different, and I think people have bought into that.
What's evident from today is the passion and the drive within GM to do things differently, and I think that we have a cohort of people here who are all kindred spirits, and we all want to do things to improve things for our population.